Hi, my name is Glory Morella, and in this video, I will discuss the pharmacological concepts of beta blockers, their types, their indications, contraindications, side effects, rationales for use in different diseases and populations, and the nurse's role in evaluating their action and response. Beta blockers are a class of medications that block the action of adrenaline and noradrenaline on beta receptors in the body. By doing so, they reduce the effects of these hormones such as slowing heart rate, reducing blood pressure, and decreasing the workload on the heart. Types of beta blockers. First is the non-selective beta blockers. These block both the beta 1 and beta 2 adrenergic receptors. Examples include propranolol, nadolol, and timolol. Non-selective beta blockers have a wide range of indications, including hypertension, angina, arrhythmias, migraines, essential tremors, and glaucoma. Second is the selective beta 1 blockers, also known as cardioselective beta blockers. These primarily block beta 1 adrenergic receptors. Examples include metoprolol, atenolol, and bisoprolol. Selective beta 1 blockers are commonly used in conditions such as hypertension, angina, heart failure, and post-myocardial infarction. Third is the beta blockers with intrinsic sympathomimetic activity. These beta blockers have partial agonist activity, meaning they can stimulate adrenergic receptors while also blocking them. Examples include pindolol and acebutolol. Beta blockers with ISA may be used in patients with mild hypertension or angina pectoris as they have a reduced negative impact on heart rate. Next is the beta blockers with membrane stabilizing activity or MSA. These beta blockers possess additional properties beyond beta blockade. Examples include propranolol and carvedilol. Beta blockers with MSA may have antiarrhythmic effects due to sodium channel blockade and are used in conditions like arrhythmias and hypertension. Importance of the nurse's role in pharmacology and medication administration. As nurses, we play a crucial role in pharmacology and medication administration in ensuring patient safety and optimal therapeutic outcomes. As nurses, we are responsible for number 1, assessing patients' medication needs. By conducting thorough assessments, nurses gather essential information about patients' medical conditions, allergies, and current drug therapies. This data helps in developing an appropriate medication plan. Second is administering medication safely. Nurses are trained in medication administration techniques, including proper dosage calculation, medication verification, and correct administration routes. Our expertise minimizes the risk of errors and adverse reaction. Third is monitoring patients' response to medications. We closely monitor patients after medication administration, assessing for therapeutic effects, adverse reaction, and drug interactions. We document and report any changes or concerns promptly. Number 4 is providing patient education. As nurses, we play a vital role in educating patients and their families about medications, including dosage, timing, possible side effects, and necessary precautions. This empowers patients to actively participate in their medication management. The mechanism of action of beta blockers can be summarized as follows. First is cardiovascular effects. Beta blockers reduce heart rate and myocardial contractility by blocking beta 1 receptors in the heart. This decreases oxygen demand, improves symptoms of angina, and help manage arrhythmias. Second is blood pressure regulation. By blocking beta 1 receptors in the heart and beta 2 receptors in blood vessels, beta blockers reduce the force of heart contractions and relax blood vessels, resulting in decreased blood pressure. Third is renin-angiotensin-aldosterone system suppression. Some beta blockers inhibit the release of renin, an enzyme involved in the production of angiotensin II. This leads to a decrease in vasoconstriction and fluid retention, making beta blockers useful in managing hypertension and heart failure. Indications for beta blockers use includes hypertension, coronary artery disease, angina pectoris, myocardial infarction, heart failure, and arrhythmias. Beta blockers are commonly prescribed for controlling high blood pressure. They reduce heart rate and cardiac output, thereby decreasing blood pressure. Beta blockers help manage angina by reducing heart rate, cardiac workload, and myocardial oxygen demand. They can be used both for stable angina prevention and acute angina attack relief. Beta blockers are often prescribed post-myocardial infarction to reduce the risk of recurrent cardiac events and mortality. They help stabilize the heart, prevent arrhythmias, and improve overall cardiac function. Selected beta blockers have been proven to improve symptoms, reduce hospitalizations, and increase survival rates in patients with heart failure. Beta blockers are effective in controlling various types of arrhythmias, such as atrial fibrillation, ventricular tachycardia, and supraventricular tachycardia. They normalize heart rate and rhythm by blocking abnormal electrical signal. When prescribing beta blockers for hypertension, it is important to consider the patient's overall cardiovascular status and any concurrent conditions such as asthma or peripheral artery disease. Selective beta 1 blockers like for example metoprolol or atenolol are generally preferred in patients with asthma to minimize the risk of bronchoconstriction. When initiating beta blockers in heart failure patients, it is important to start with low doses and gradually up titrate while monitoring for signs of worsening heart failure or fluid retention. And lastly, when prescribing beta blockers for arrhythmias, it is important to consider the specific type of arrhythmia and choose the appropriate beta blocker. For example, non-selective beta blockers like propranolol may be preferred for ventricular arrhythmias, while selective beta 1 blockers like metoprolol are commonly used for atrial fibrillation. Pathophysiologic principles making beta blockers effective. Hypertension is characterized by an increase in blood pressure, often associated with increased sympathetic nervous system activity. Beta blockers counteract the adverse effects of sympathetic stimulation by blocking beta receptors, resulting in reduced heart rate, cardiac output, and peripheral vascular resistance. These effects collectively lead to a decrease in blood pressure. In heart failure, the sympathetic nervous system is activated, leading to increased heart rate, myocardial contractility, and afterload. This chronic activation further worsens cardiac function. Beta blockers block the detrimental effects of excessive sympathetic stimulation by decreasing heart rate, reducing myocardial oxygen demand, and improving ventricular function. In arrhythmias, there may be abnormal electrical signals or increased sympathetic activity contributing to the irregular heart rhythm. Beta blockers normalize heart rate and rhythm by blocking beta receptors in cardiac tissues. By inhibiting the effects of sympathetic stimulation, beta blockers help restore a more regular electrical conduction system and prevent arrhythmia episodes. Specific considerations for each disease when prescribing beta blockers. In hypertension, consider potential contraindications like for example asthma or peripheral artery disease, and select beta blockers that minimize the risk of adverse effects in specific patients' populations. Monitor for signs of therapy intolerance or worsening symptoms. In heart failure, initiate beta blockers at low doses, gradually titrate upwards, and closely monitor for signs of decompensation or worsening heart failure. Individualized therapy based on the patient's clinical status, and consider the specific beta blocker with proven efficacy in heart failure, like for example carvedilol or bisoprolol. In arrhythmias, choose the appropriate beta blockers based on the type of arrhythmia and desired effect. Monitor for heart rate control, potential pro-arrhythmic effects, and drug interactions. Common side effects of all beta blockers include slow heart rate or bradycardia, low blood pressure or hypotension, fatigue, dizziness, nausea, insomnia, sleep changes and nightmares, dry mouth or eyes, and the rare side effects include sexual and erectile dysfunction. Contraindications for beta blockers include severe bradycardia or heart block. Beta blockers can further slow heart rate and worsen conduction abnormalities. Next is uncontrolled heart failure. Patients with decompensated heart failure may experience worsening symptoms with beta blockers. Severe asthma or COPD. Non-selective beta blockers can induce or exacerbate bronchospasm. Raynaud's disease. Beta blockers can worsen vasoconstriction and ischemia in patients with this condition. Last is Prinzmetal's angina. Beta blockers can worsen coronary artery vasospasm. Using beta blockers in different populations. Pediatric population. The use of beta blockers in pediatric patients is relatively limited compared to adult population. However, beta blockers may be considered in certain pediatric conditions such as hypertension, cardiac arrhythmias, and less commonly in heart failure. The rationale for beta blockers used in pediatric patients is similar to that in adults, focusing on reducing heart rate, myocardial contractility, and blood pressure. However, prescribing beta blockers in the pediatric population requires careful considerations of the potential benefits and risks, as limited data exists regarding their safety and efficacy in children. Beta blockers are commonly used in the geriatric population for various indications, including hypertension, heart failure, and arrhythmias. In this population, beta blockers may help in managing cardiovascular diseases. However, it is important to consider age-related changes in pharmacokinetics, comorbidities, and polypharmacy when prescribing beta blockers to older adults. Those adjustments, careful monitoring for adverse effects such as bradycardia and hypotension, and regular assessment of renal and hepatic functions are essential in this population. The use of beta blockers in pregnant patients requires a careful assessment of the potential benefits for the mother and the potential risks for the developing fetus. Beta blockers may be considered in pregnancy for specific indications like hypertension, certain arrhythmias, and thyrotoxicosis. The choice of beta blockers should consider the safety profile and potential teratogenic effects. Beta blockers are generally classified as Category C drug in pregnancy with limited human data available. Propranolol is one of the most studied beta blockers in pregnancy and has not been associated with an increased risk of major fetal malformations, although there may be a small risk of intrauterine growth restriction. Close monitoring during pregnancy and collaboration with a maternal fetal medicine specialist is essential. Nurses' role in monitoring and evaluating the action and response of patients receiving beta blockers. First is assessing vital signs. Regular monitoring of vital signs, including blood pressure, heart rate, and respiratory rate, is essential in evaluating the response to beta blockers. Nurses compare current measurements to baseline values and desired therapeutic goals. For instance, in hypertension management with beta blockers, nurses assess the impact on blood pressure levels, aiming for reductions within target ranges. Observing and assessing specific symptoms related to the condition being treated with beta blockers is crucial. For instance, in heart failure patients, nurses monitor for improvements in symptoms such as dyspnea, orthopnea, peripheral edema, and exercise tolerance. By documenting changes in symptoms, nurses can evaluate the effectiveness of beta blocker therapy. Beta blockers can cause various side effects and adverse reactions. Nurses should educate patients about potential adverse effects and closely monitor for their occurrence. Examples of side effects include bradycardia, hypotension, bronchospasm, fatigue, depression, and sexual dysfunction. Nurses assess for the presence of these side effects, promptly report them, and collaborate with healthcare providers to address them while ensuring the benefits of beta blockers are maintained. Nurses can utilize objective measurement tools to evaluate the effectiveness of beta blockers in managing specific conditions. For example, in patients with cardiac arrhythmias, ECG can be employed to assess changes in heart rhythm and conduction. Holter monitoring can provide valuable data on heart rate variability and arrhythmia frequency. These tools help nurses objectively assess the response to beta blocker therapy. Nurses play an essential role in collaborating with the healthcare team, including physicians and pharmacists, to evaluate the response to beta blockers effectively. They communicate any concerns, changes in vital signs or symptoms, and facilitate appropriate adjustments to beta blocker therapy. Collaboration ensures comprehensive evaluation and optimizes patient care. In conclusion, knowing the pharmacological concepts of beta blocker, their types, their indications, contraindications, side effects, rationales for use in different diseases and populations, and the nurse's role in evaluating their action and response is vital to optimize patient outcomes. And these are my references. Thank you.